I would like to extend a very warm welcome to you all, and thank you for sharing your time with us today. I guess all of you had a pretty exciting extended weekend holiday, and you still have fond memories of it. So my name is Sachin, and together with my colleague Pankaj Josha, we will take you through our session today, which is centered on the meaningful use stage 2. And nonetheless, we are really excited about this webinar, and I'm sure you are also looking forward to it. Before I just proceed, just a small introduction about Harbinger systems. So Harbinger Systems is part of the Harbinger Group, which is a leading global provider of innovative software products and solutions and services to companies in over 57 countries. Harbinger Systems, has been in this business for the last 23 plus years, and we provide software engineering services to startups and ISVs. And a couple of years back, we started with the healthcare practice. So, our track record in this field has been that, we have been working with the startups and ISVs in the healthcare sector. We are predominantly engaged in building products or platforms in the areas of EMR, EHR, CPOE, helping on the regulatory compliance, revenue management, mobile prescription, wellness, or the digital health part of it, and also on the e-learning front. So, over the course of the last couple of years, we have kind of generated good amount of domain knowledge in the healthcare, and one of the core piece of that is the meaningful use too. So, we thought let's be in a position to share this information, and considering that this is a kind of a pretty complex and technical sphere in itself. And most vendors would like to have some sort of an additional information or and helping to really work on this. So before I proceed, a couple of housekeeping instructions. All the attendees are on mute, and what we would really appreciate is if you could make use of the question panel, which is in the lower right of your GoToWebinar window. This is the best way to communicate with me and Pankaj during the webinar. So we are going to keep an eye, I'm going to keep an eye on the question box as Pankaj moves through the material. And we are going to keep track of it. So, your questions are going to come, and we are going to take a note of it, and if possible, we would, answer them during the presentation, or we would take it during the Q&A forum. So if your question is not answered or covered in total today, what we are going to do is we are going to come up with the Q&A document, and we would be emailing the recorded webinar, the audio, the presentation, as well as the QA document. So, the webinar is going to be recorded, so, you can feel free to share with your colleagues or to anyone that would be, benefiting from this. So, coming to the question, just yesterday I read a kind of a note which from CMS that said that the, as of date, the total, dollar handout had exceeded, somewhat around $180 billion. And so, considering that as a background, this is an interesting state, the EHR. If you're in most of them who are the EHR vendors, this is the kind of an real, the crux of the time, basically the sunshine period. And, a couple of observations what we got through is that if you look at the market share of the EHR vendors, and I'll come out later to you as to why I'm kind of referring to this. The industry reports point out that anywhere between 30 to 40% of the EHR market is comprised of various vendors, and these vendors, they don't qualify in the top 10 vendor list. You have the various agencies which come out with the top 10 kind of a list. So 30 to 40% of this share is up for grabs. So this is up for grabs for both the bigger EHR companies as well as it's a fight for sustaining your business for the smaller EHR vendors. Then on the government initiatives, you have various state initiatives that are laying more focus on ensuring an outcome-driven goalpost. And the third really interesting point for the EHR vendors to really look out is there are advancement in technologies, driven mostly by cloud and mobile apps. I mean, a couple of years back, iOS on the screen, everyone is really happy with it. People were really not, tuned to the kind of present-day mobile apps that we are seeing, where, using a mobile app, you can find out a doctor near you, you can schedule a meeting with him. There's also a possibility of sending across, the images of your injury and getting a kind of an opinion from your physician or your doctor. So these three related points, they really converge for the EHR vendor primarily. So this goes back into the meaningful use too, because the overall goals of meaningful use include reducing health disparities, engaging patients, improving the care coordination, and keeping the protected health information secure. And as most of you from the field are aware, the EHR switching has started and it would peak in 2014 and it would nearly stop in 2015. So what we are looking at is either the small EHR companies going out of business if they do not comply to MUT, or they're being bought over by bigger ones who have an MUT product ready, and the smaller ones' client base can be quickly migrated to the product. And so that is the exciting phase. And with the deadline to 2016, what we are going to see in the next 2 years is interoperability. That was going to be the USP for a EHR vendor, and that's courtesy of the MUT. So MUT is, it's very well known, but let me just kind of comprehend it. So MUT requires greater interoperability between the HR systems, and it is intended to boost health information exchange between providers and promote patient engagement by providing patients with secure online access to their health information, that is through the patient portals. So, here is the agenda that we have. We're going to cover is the stages of meaningful use, the steps or approach to achieve MU2. We're going to subtask it into prerequisite, identifying your starting point, helping you draw your timeline, then also discuss on upgradation of your EHR, and implement the required core and menu objectives, which is the core of the MU2. And we're also going to look at integrate meaningful use measures into your workflow, and something on a patient engagement plan. So I mean, most of you are really aware of MU2, and it's out there on the slide. But just to kind of make it out in a clear way. So the eligible professionals, your eligible hospitals, critical access hospitals, they have to adopt, implement, upgrade, or demonstrate meaningful use of the EHR technology. And there are various ways you could do this to demonstrate that. It could be recording patient information, structured data, to exchanging summary care records, and then to qualify for the meaningful use incentive payments, which is where the money is really for your end clients. So the eligible providers must not only adopt an EHR, which is MU2, but also show that they are meaningfully using their EHR by meeting a number of objectives designed to have a positive impact on patient care, which is ultimately the outcome goalpost, that the whole healthcare industry is trying to confuse to. And ultimately creating an infrastructure that improves the quality, safety, and efficiency of patient care in the United States. So, that's really an exciting part and easy way to kind of put across what is MU2. So another important point, how is it going to benefit is The health information is going to be available to all authorized stakeholders for improved coordination and continuity of care and promoting informed decision making. It's going to enable the patients to take a more active role in the healthcare of personally there and even that of their family members. So with a 360-degree view of the patient medical history or his information, that would greatly help in reducing the risk of medical errors or avoiding duplication of treatments and procedures. And lastly, the important point is your end clients will get incentives from CMS. Sorry for that. So here we are with the stages of meaningful use 2. Now, we are all, clearly understanding that this is into a stage 3 kind of a structured way. You have stage 1, which was done in 2011 and 12. You have stage 2, which is currently in focus, and stage 3, which is planned to start in 2016. So meaningful use stage 1, the main focus is on data capturing and data sharing. So this was launched in 2011, and it emphasizes proper electronic data capture and data sharing using an EHR technology. And eligible providers could attest to stage 1 and receive their incentive payment after meeting 13 core objectives, which was previously 15, and then 5 out of the 10 menu objectives. So meaningful use 2 is a step further to stage 1, and that is more focused on the advanced clinical processes. So it's officially started in 2014. It was supposed to go live in 2016, but that's now got delayed. So it adds some new objectives and measures as well as higher thresholds, which requires providers to extend their EHR capabilities to achieve it. And the interesting part now is that to attest to stage 2, eligible professionals will have to meet 17 required core objectives and 3 out of the 6 menu set objectives. So once you are done with the stage 2, then with the oncoming stage 3, the details are not yet defined, but the main focus is going to be on improved outcomes. So that's what the entire healthcare industry is moving towards, is the outcome-driven goalpost. So stage 3 is likely to follow the same format as the first 2 stages, but and that is going to be increased higher thresholds and more extensive requirements. And based on the current timeline, provider would begin stage 3 2 years after achieving the stage 2 meaningful use, meaning no earlier than 2016. So as per current updates, it may be extended by 1 year to start in 2017. So just to summarize the meaningful use stage 2, almost all menu items in stage 1 become core in stage 2, which is logical and a part of the outcome-driven strategy. And also the threshold is increased. Several new measures have got added, like patient portal. It's a fantastic option to, or rather platform for ability to view and download or transfer your health information. Now this is done securely in terms of an online messaging for patients, the ability to view images in EHR for, so that is what I was saying about the recent advancement in telemedicine part of it. You take a photo of your injury and you kind of send it across to your doctor. So clinical notes, EMR, these are the additional part of it. Encryption of the data at rest or the direct protocol, the reporting part, and then the additional interoperability requirements, e-prescription, and many more. So in the first year of participation, the providers must demonstrate meaningful use for a 90-day EHR reporting period. And in subsequent years, the providers will demonstrate meaningful use for a full year EHR reporting period, except in 2014. So now with this kind of an background, so let us now dwell into the main core part of it, and for that let me hand it over to Pankaj.
Thanks, Sachin. Hello everyone. So I will be talking mainly about like the steps, the prerequisites or the steps or approach one need to follow, some high-level end-to-end flow to go for certification, and some implementation details with an example of direct project and e-prescription. So let us first talk about the prerequisites. So here, like as a vendor, like once you have decided, or like once you want to go for a meaningful use certification, so as a vendor or HR vendor, like what all things you need to do. So before you start, like the prerequisites are like, first you need to check your eligibility to participate in the Medicare or Medicaid EHR incentive programs. And for this, like CMS has provided a very good eligibility assessment tool, and using this tool, like you can check whether you are eligible, or like what are the norms, what you need to follow. So basically using the tool you can check your eligibility. So once you have confirmed that yes, you are eligible, then you need to prepare for registration. And again, for this, like CMS has provided a very good checklist through which you can see what all things you need to be ready with to go for a registration. So even when this is done, the next thing is to go for registering and register to participate in the Medicaid and Medicaid EHR incentive program. And for this, like you can follow this URL, ehrincentives.cms.gov. So once you have registered, so there are a couple of more things that you need to find out, like determine certification of your EHR systems. So you must be at 2014 certified, because like if you are a 2011 certified EHR, then that is going to expire this year. So your EHR need to be 2014 certified. Then the next thing is like to get your CMS EHR certification ID that identifies the certified EHR technology being used to demonstrate meaningful use. For that also, like IT is providing a tool where you can like enter the details of your current CMS, and you can get your CMS EHR certification ID. And now as you are ready with all these things, so they're just for the sake of completion of like the end-to-end steps. So the other step, the next step after this prerequisite would be to go for go behind the requirements of like meaningful stage, and where you need to meet the core and menu objectives. And so this part I will be talking in details in my next few slides. Like okay, so how you can achieve the core and menu objectives, and what all things you need to change in your EHR, and like how even outside of your EHR, like what all things you will need to do. So the next step would be to make changes in an EHR, make it compliant with the like all the requirements of MU2. And then once you have met all the core and menu objectives, so you need to check the implementation alignment by using the CMS attestation calculator. So this also like CMS is providing a tool which is called Stage 2 Meaningful Use Attestation Calculator. And for Stage 1 also, like Stage 1 Meaningful Use Attestation Calculator is there. So using this tool, you can check all your implementations, whatever changes you have made, all the modules, whatever added in your EHR system, whether they are aligned with the compliance, meaningful use compliances or not. So while development also, like you can check this alignment. So now once you are ready, and like once you have got a green signal from that meaningful use attestation calculator, so now you are good to go for attestation. And for this, you can, with the help of our attestation process, like CMS again provides a very useful user guide, and they are like they have provided all the details, like you need to create a credential, you need to have a login, and there you need to feed all the details, and using that they will guide you to the process where you can get your implementation attested. So once your EHR is like meaningfully attested, so the next step is very important to retain the proper documentation in case of audit. So an audit process may happen prior to receiving payment. So this system written or like maintaining proper documentation is also very easy. And also it's very important to continue reporting meaningful use data every year and avoid Medicare payment adjustments. So these are basically like the high-level approach like one EHR vendor need to follow to meet the meaningful use certification. So now let us focus on some low-level details or some important aspects from implementation point of view. So here like we have divided the implementation approach in like basically 5 stages. So these are like determine the starting point, draw your timeline, update your EHR system, bring meaningful use measures into your workflow, and create your patient engagement plan. So let us see all these steps in little detail. So the first is like determine your starting points. So depending on like what kind of EHR you have or what all implementations you have in that EHR, so you need to assess your current system or state. So once you have gone through all the MU2 requirement, let us assess your current system or state. See what all you already have, what all modules need some changes, what modules need complete revamp. So this will help you in determining your starting point. So you also need to check or like see like whether you are already attested to stage 1 or not. So if you are already attested at stage 1, so then you are in good shape, because most of the like or almost all the objectives of stage 1 are now have now become the core objectives in stage 2. So that would be a good thing for you, because like then you will not need much of the changes as compared to the state where you are going to start even stage 1 in 2014. So the last year to begin the participation in the Medicare EHR incentive program is 2012, and for Medicaid it is 2016. So if you are getting started with meaningful use in 2014, so you will not be eligible for full incentive payment, and that we will show in our next slide, but that will avoid the looming penalties. So you could face a 20% fee schedule reduction in 2016 if you do not meet meaningful use in 2014. So that is again like very important for you to get started very soon. So as far as like the core stage 2 is concerned, and like the core and menu objectives are concerned, so all the eligible professionals must meet 17 core objectives and 3 out of 6 menu objectives. And for eligible hospitals and critical access hospitals, they must meet 16 core objectives and 3 out of 6 menu objectives. So for many of these stage 2 objectives, the threshold that providers must meet for the objectives has been raised as compared to stage 1. So it's very important to like assess your starting point and determine like where to start with. So the next thing is draw your timelines, because know the timelines versus incentive plotting, as incentive amounts depends directly on when you are starting with meaningful use. So from this diagram you can see like if a company has started meaningful use stage 1 participation in 2011, so they will be getting more incentive as compared to companies who have participated in next year, or like 2012, 2013, and or maybe like in 2014. So it's very important to like start this as soon as possible to get more incentive and like some other benefits. So and the other, yeah. So let us go to the third and the most important part of meaningful use certification, and like here like the most important thing is like upgrade your EHR system. So basically like you need to have a 2014 certified EHR, and as per the phase 2 criteria, you need to have implementations for modules like patient portal, secure message, patient messaging, e-prescribing, and electronic notes, clinical quality measures, and several other features, several other criteria are there. So you need to meet those. Apart from this, some other emphasis on increased interoperability, like order and result exchange electronically transmit a summary of care records. Some other criteria in area of like exchange requirements are like the direct project, which is again very important, and I will be talking in my next slide about direct project details. Then the discharge summaries, CCDs, referral, clinical care document architecture, and some of the important transport protocols that one need to follow to exchange patient data from one system to another system. So let us go to let us see like one example, like okay, so how we approach the implementation. Suppose like if we have to take an example of direct project, like okay, so what will be our approach, or like how we approach this implementation. So direct project is as like most of you might be knowing that direct project implementation is responsible for packaging message content, securing it, and transporting it from one location to another location. So suppose like as a patient, like if I have been referred from one hospital to another hospital, so I need to carry all my data or like transfer all my data from one EHR or from one hospital to the new hospital where I have been referred or where I'm going to have my new treatment. So it's very important to pass all the historical data, family details, each and every details of my health related to my health to from one EHR to another EHR or one system to another system or one doctor to another doctor. So, and it's very important to like encrypt the message, securely transport it over the wire and like pass it to from one secure location to another secure location. So here like the content is packaged using my multipurpose internet mail extension protocol, and for confidentiality and integrity of content we use S/MIME encryption and some digital signatures. Authenticity of sender and receiver is established through F509 digital certification, and routing of messages handled through SMTP. Some supported XML standard formats are CCDA, C32, and CCR. And like for different clients, like we have worked on all three formats. Okay, so let us go through some important aspects again, like related to direct project implementation. So there are two most important things, like for securely exchanging the patient health information from one provider to another provider. And the first is like transition of care, where and like here also like we have two EHR certification criteria, that your EHR should be capable of receiving, displaying, and incorporating transition of care reference summaries. And the second is create and transmit transition of care reference summaries. So you should be able to electronically create a transmission of care reference summary formatted according to the CCDA specification and as defined by CMS for meaningful use. And the other is like enable user to electronically transmit CCDA on supported transport protocols. And the transport protocols are direct, which is an required one, and there are two optional protocols, direct plus XDR XDM and SO plus XDR XDM. So these two are optional, but the first one is like compulsory. And like one EHR can have all three implementations depending on the need or like how flexible they want to make their system. So suppose like if apart from direct, if they have some requirement of some client comes to them and they want to transmit their data over SOAP protocol, so they can have this flexibility also. So basically in meaningful use criteria, like these three transport protocols are supported. So if we talk about like direct, so basically here if we want to see like okay, so how system will be sending the CCDA document. So system will pick the CCDA document, locate destination and associated certificates, sign and encrypt S/MIME attachments, send email from using SMTP. So this is how like the direct protocol or the direct transport happens. So other is like direct plus XDR XDM. So here this certification is identical to the previous one, which is direct and only involves the addition of the ability to wrap the CCDA document with associated metadata and place it with S/MIME attachments. So here like the only difference in the flow of CCDA document would be the system will pick the CCDA document using XDM wrapper, it will zip with metadata and one-end docs and locate destination and certificates, sign and encrypt SMIME attachments, send email using SMTP. So this is like another way of sending data using direct plus XDR XDM protocol. And the third one is SOAP plus XDM. So again, in this scenario, XDR relies on SOAP, which is web service, and not email as transport. However, if offers the same ability to wrap the CC documents with associated metadata and place it on SOAP message. So here, one thing to be noted is this is not an SMIME attachment, but the SOAP attachment method supported by all SOAP stacks. So this is how like the three different transport protocols are there, and like a different way of like how the CC document flows from one system to another system. So once like we have implemented all the changes, all the requirements of direct protocol, so let us see how we can test this direct protocol implementation. So basically for this we have a tool called transport testing tool, TT, or in short we call TT tool. So this is developed by National Institute of Standards and Technology, and the goal of this test is to certify that an EHR or EHR module is capable of allowing a user to receive, display and incorporate patient information sent in to the user in CCDA format via all supported transport protocols that we discussed in last slide. So this tool basically determines the level of conformance of populated CCDA document against the specifications. So here the validation results are rendered to user in XML format and also indicates if there are any non-CCDA conformance segments present. So for non-conformance segments, it triggers some error and warning message in user readable format within the tool. So it's a kind of very user friendly, and like you can directly see if in your implementation if there is some misalignment or like something which is not compliant or like not as per the requirement of meaningful use. So and like it will also trigger an error or warning message. So that way like it gives you an end-to-end satisfaction, like okay, so whatever you have implemented is correct or not. So this tool also provides different ways through which one can validate different actions, like sending message, where users CHR can test their ability to send message with CCD attachment to the TTT, receiving message, manual validation, validating receipt of an MDM, sending invalid signing certificates, and any other action whatever is present as part of the direct protocol. So for this tool, like we have two interfaces, like the one is web and second one is local interface, and this tool is supported only in Linux based operating systems. So this is how like once we have implemented the direct protocol, direct project, so using this tool we can quickly test our alignment with the requirements. So let us take another example, e-prescribing, or we can say like prescription management process from hospitals to pharmacists. So here like the prerequisites are like medicine details, like medicine name, its code should be present with the system. Pharmacy details need to be present with the system. So when these two details are with you, so we can start with the actual implementation of e-prescribing. So here like the first and the main important part is like generate e-prescribing XML by placing an order with details like required medicine, dose, quantity, etc. And once this order is placed, this information is placed in the system against a patient in database. Then we need to sign the order using electronic signature and save in system. So this will make our data more secure before we transmit this data. System retrieves the order which is just now saved in with electronic signature, and it retrieves the patient information for whom the e-prescribe was issued and the pharmacy details to whom the e-prescribe is intended to. And once we have all these things ready, then we use the JXP features provided by Java 7 to generate required XML. So then the next step would be it then displays the e-prescribe XML to UI and in background pushes the e-prescribe XML to JMS message queue, and from JMS queue we send the data to pharmacy. And again, to test this tool, like we have this link, and from this tool we can very well test the e-prescribing implementation. So if we look at like the overall steps, so we talked about like the assess your current, get your starting point, get your timelines, changes in the meaningful changes in the EHR system, and the fourth high-level step is to bring meaningful use measures into a workflow. And this is needed to ensure the right person is doing the right work and to bring the right information to the right provider at the point of care. So basically, like a physician or a doctor or like a patient should have access to the information which they are eligible to see or authorized to see. And to do this, like you also need to provide some kind of training or awareness of new workflow to your stakeholders. And the last step for this is to create a patient engagement plan. So in stage 1, we have seen the main focus for patient engagement plan was to provide timely access to patient information. And in stage 2, it has more emphasis on patient engagement and empowerment. So here basically we need to have a patient portal so that patient can download and even transfer his treatment data, his health related data to other doctor or other healthcare or hospitals or other places. And that data can also be shared with patients' family members. So in case of emergency also, like the other people know the details. So a patient engagement is like very important, and also like patient can see the track and like see how is his treatment going, and like this data can also be used by government agencies for some other R&D and other purposes. And for this, like government or CMS has also set some measurable criteria that more than 5% patients should view, download or transmit to third party their health information. And also a secure message must be sent using the electronic messaging function of certified EHR technology by more than 5% of unique patients seen by eligible professionals during the EHR reporting period. So these were like the 5 high-level approaches. And once you have like met or done, or once you have like passed or like met all these high-level approaches, so the next thing would be to attest that you have met the threshold and all the requirements of Medicare or Medicaid EHR incentive programs. And again, as I had said in my like high-level end-to-end flow, like retain proper documentation in case of an audit, because like you may be audited prior to receiving payments by CMS, and continue reporting meaningful use data every year and avoid Medicare payment adjustments. As far as like the testing is concerned, so as I indicated, like for direct project like testing, like we have TTT tool, and for e-prescribing testing, like we had another tool. So similarly, like CMS has provided set of all the test cases against each and every implementation, whether it is like core objective or it is menu objective, and using those test cases, one can very well validate the implementation or the module implementation one has done to meet the requirements. So I think this was from my side, Sachin.
So thanks, Pankaj, for walking us through the entire, the complex process of MU2, and I hope the attendees have also found this useful. So we have a couple of questions, but as I understand, we are also close to our time. So in that case, I'm just shortlisting 2 questions, but we are going to send out the Q&A document, and it would also get you would receive a copy of the same. So Pankaj, what I understand is there are challenges and opportunities. If you look at from the EHR vendor perspective, that the engineering challenge, the professional service capabilities also that are required for this stage 2 is quite significant. So then my question to you, Pankaj, is how should or how can a small EHR approach MU2 given the limited internal bandwidth? And what we have seen is the 30 to 40% market share, which is outside the preview of the top 10. And these are the guys who would rather be interested for this kind of advice. So how would you advise them?
Okay. Thanks, Sachin. This is a very good question. So here, based on some recent experience on kind of projects, so I have two examples. Like in one of the projects, what we are doing is the client is doing the implementation of the core objectives, and there are some peripheral modules if I take an example of the transport protocols. So there, the client himself is doing the direct project implementation and direct protocol implementation, and for rest of the optional implementation, optional transport implementation. So that responsibility they have shared with us. So we are doing from our end, and we are creating pluggable components which they can directly integrate in their system, and this way they can get help from us. So this will save time also, because client in parallel will be doing the one part of the implementation, and in parallel we will be doing the other implementation. And one other example could be maybe we all can work on the same system, and there also client again we will be dividing that task, and some part of implementation will be done by client and some part of responsibility we can handle.
Okay, so that would make a judicious use of the internal domain expert or subject matter expert at the client's end.
Right.
And for them to kind of have a technical rich pool, to come and work for maybe this meaningful use journey, which would be a limited timeline activity. Right. So rather than going all across, trying to have them internally, they can kind of use this model to effectively go and meet their objectives.
Very true.
Right. So another question that could lead, from the way you described as to how one could go. So, we understand the object implementation is the crucial, and in that we have two, core and menu objectives. So obvious question is, when you talk about any big system implementation like ERP and, those kinds, they have something called a big bang implementation, which is everything at one go. Now, with that as a background, do you think this core and menu object implementation, can they be done in parallel, or it has to be done independently?
Okay, so I think both is possible. It can be done either in parallel or even independent. So suppose some of the implementations can be shared, or if client wants to do some of the implementation by themselves, and they want to share some of the implementation responsibility with us, so that is very much possible. And from our, from one of my recent experience, so there what we have done is some of these core implementations client has done by themselves, and some of the implementation we have done, and we have shared the code and implementation with them as a service, and then that was directly pluggable to their system.
So thanks for that, and I guess we are right on track. I mean, the time availability is kind of, we're almost finished to it. So we have a couple of more questions, but I'm afraid we'll have to kind of take them out in the offline mode. So we'll have the questions and the answers drafted, and we'll send it across through a Word document. And what we are also going to request the attendees is, once you once this meeting gets over, you'll have a survey, the feedback form pop up on your screen. It would really help us if you could provide your feedback. That would help us, really in our efforts. That will also let us know, how is the right approach to kind of, help across all of you, because, you guys have spent, 45 minutes of your crucial working day time with us. So, it would just help us, all of us together. So once again, thank you for your time. Appreciate your support and look forward to your feedback. Thank you. Have a great day.